tell us more about the treatment options for keratoconus and what the refractive surgeons normally, all the options they would consider and combinations of them.
So I think which is very, very important is before we start talking about how we're going to make you see better, is that keratoconus is a progressive disease. So regardless of whether the optometrist is going to give you spectacles, whether they're going to give you scleral lenses, or whether we're going to perform surgery on your eye, we need to determine is your keratoconus progressing. Okay, and almost in all children and in teenagers, if they're diagnosed with keratoconus, the chances are highly likely, or there's a high likelihood that they will be progressing, and we need to address that first, because there's no sense in giving a patient like perfect vision and the vision just keeps on deteriorating. So we talk about cross-linking, and that's our first step. And if we, so there's different protocols and there's different ways that people address progressing, like or stop progressing in children, or let me say the indications for cross-linking. But in our practice, what we say is that any kid or teenager younger than the age or younger than 20 years of age with confirmed keratoconus, they will get cross-linking. And then any person older than 20 years of age that is actually progression or shows progression on their tomography, the keratoconus is getting worse and there's evidence of that, they will also undergo cross-linking. And so what is cross-linking? Cross-linking is where we use a UV light and we combine it with vitamin B drops, and it's a procedure that gets done in the practice, in the doctor's office. It takes about 20 minutes, and the combination of the two hardens the cornea. So we just get some tensile stability or strength into the cornea and prevent this protrusion or conical formation from progressing in the cornea. So other general examples of that is if you go for your nails, the ladies, you put your nails in that little UV oven and they harden the polish, nail polish, or if you go to a dentist and they actually use like a UV light to harden the filling in your tooth. So that is the most important part of managing keratoconus. Then, as Yolandie said, is that the mainstay of treatment, if possible, is glasses. If you don't see well with your glasses, so let's say your keratoconus has progressed quite a bit and you don't get clear vision even with glasses, then they can either fit you with scleral contact lenses, hard contact lenses. There's so many types of contact lenses that they can help you with, but what is important is that soft contact lenses usually is not going to be sufficient in this at this stage of the disease. And then we have patients that are just not tolerant. They've to these contact lenses. They've tried scleral contact lenses. They've tried hard contact lenses. It really makes their life difficult. They can't see clearly. They are really intolerant to scleral contact lenses. Then those patients come to us, and we can actually help them. We also have patients where scleral lenses, they can fit it, but it's impossible with their lifestyle to actually use it regularly. And in those patients, we can then also consider a surgical route of treatment of keratoconus. So when a patient comes to see me with keratoconus, and then the first thing we do is we stage it, and there's 4 stages, and stage 1 to 4, and I'm not going to bore you with the details there, but it basically boils down to how well this patient can see with his glasses and whether the disease is stable. Is the keratoconus stabilized? If the patient